Hi, I'm Dr. John Young, and this is Tiffany, and we're with Foundational Health Clinic here in Largo, Florida. And we are seeing more and more cases of people just coming in and they just don't feel right. And the labs look great, and we've seen them a lot of times for a while, and they're pretty healthy over the years, but all of a sudden they're just blah. So, Tiffany and I have been picking up on some things. We're a little bit slow here, but we're starting to pick up. So, Tiffany.
All right, so what's causing all of this, right? So
Yes.
we, of course, explore medical history and sure enough find out that these patients are or have had COVID in the past, either whether they had it in 2020 first came out or whether they've had it, 2021 or even last year. And these effects of long COVID are really affecting a lot of our patients. And I have patients that come in and their medications that they've been on for years are no longer working for them. We have patients that are now having extreme headaches all the time, can't sleep. I have my female patients where it's really messing up their menstrual cycles, and really just a lot of separate symptoms, but together it all makes sense when we put together that history of COVID infection. And so really what happens with COVID is it disrupts that cell-to-cell messaging in our bodies. So when patients come in and they say, hey, I had COVID, I lost my taste and smell, and I still can't taste and smell, right? So that has to do with the cranial nerves that are in our bodies, and those nerves send messages to the brain for the brain to say, hey, that smells like roses, or hey, that tastes like coffee. So when that's disrupted and that cell-to-cell communication can no longer happen, this is why we're going, okay, now what do we do? So tell them a little bit about what we found out.
Well, first of all, it took us a while because it's not an easy thing. There's no blood test out there.
Well, we're still learning about COVID too and the effects
Right.
that it has long term as well.
So I think one of the things that we've learned is just, and this is why I like our practice, because we can spend more than 5 minutes with a patient.
Right.
It's talking to the patient, and it may not be on the first, second, third visit, but when you get this, one of the things that I have noticed is a number of them have said, John, I got COVID, and I've never quite been the same since. It's kind of a good one. Or I've gotten the shot, and I've never quite bounced back. So that's one of the important things to look at. Another one is I've just always been healthy, and I know a lady recently where always been healthy, and then I'm just very short of breath. And the workups are all negative. And so it's always now in the back of our mind that COVID has to be looked at. So I'm thinking of a lady that we saw recently, a runner, triathlons, and is a hairstylist, and came in and she just said, John, I got COVID in July. I've never been the same since. It's September. I basically almost had to quit my job. I can work 1 day a week doing hair, and it's murder. No energy, brain fog, headaches, achiness, just menstrual problems, stomach problems, inflammation. Wherever it shows up, they're going to complain. So there's been some interesting studies in treating it, and we were really impressed with some information that's come out of clinics in Southern California, Minneapolis, of using exosomes. And we've used exosomes, which is part of the cord blood, in a lot of the autistic kids that we treat. And so I gave it to her. And I told her it's not going to be instantaneous. It takes about 1 to 3 days. But I saw her about a week later, and she says, John, you're right. After about that second day, something was going on, feeling not running any marathons. And I've been following her, and she checks in once a week. And basically, it's been about 4 weeks, and she's back to work.
Okay. So you've basically reset her body so that now the cells can communicate with each other and do their job, really, to make us more functional.
Exosomes work on cell-to-cell communication,
Right.
and that's their job. And I mean, the success rate has been very high. I think in some of these clinics it's around 90%. We're pretty close to that.
Yeah.
But it's something that people need to look at. Exosomes, we give about 125 billion at a time. It takes maybe 3 minutes. But just in looking at the literature and then now doing it in our own practice, we've been very, very pleased. The other thing is it gives people hope. So many of these people think maybe I'm just terribly depressed or whatever.
Or
But-
even they go to their doctor and their doctor just slaps a Band-Aid on it, right?
Right.
Let's just treat each symptom as a separate symptom. And really, it's just one collective symptom of long COVID.
Exactly. Because yes, if you don't look at it as the whole, you will miss it.
Right.
So we wanted to just talk to you all and just let you know that maybe that's something that you need to talk to your doctor about. But long COVID does have treatments, and they're very, very successful. And talk to your doctor or give us a call, and we'd be glad to see if we can't help you.